Most people look at their blood test the same way. They search for one word: normal. If the result is within the reference range, they relax. They assume everything is fine. They move on. But here is the truth. Some of the most important signals in your blood test are not the ones marked as high or low. They are the ones you don't understand, the ones you skip, the ones no one explains. There is one marker that doctors often glance at, but patients almost always ignore. Not because it is unimportant, but because it does not look dangerous. It does not stand out. It does not scare you. And that is exactly why it matters. Because it changes before serious problems begin. It shifts quietly, slowly, long before symptoms appear, long before diagnosis, long before anything feels wrong. Most people only react when numbers become extreme, but the body does not suddenly jump from normal to danger. It moves gradually, and this marker is one of the first to move. It may still be inside the normal range, but no longer optimal, and that difference is critical. Because normal does not always mean healthy. It simply means average. And average includes people who are already developing problems. So the question is not, is your test normal? The real question is, what is changing before it becomes abnormal? This marker is not just a number. It reflects how your body is functioning at a deeper level. It may be related to inflammation, or circulation, or metabolic stress. It depends on the context. But the key point is this: it changes before disease appears. That is what makes it valuable. The body always adapts first, before it breaks, before it shows clear symptoms. It tries to maintain balance, and this marker reflects that effort. For example, your body may be under constant low-level stress, not emotional stress, physical stress from poor sleep, from nutrition imbalance, from lack of movement, from chronic tension. You may not feel this stress directly, but your body does, and this marker begins to shift, not dramatically, but consistently. Another important factor is inflammation. Low-grade inflammation does not feel like illness. There is no pain, no fever, no obvious sign. But inside the body, processes are changing. Blood vessels may become less flexible. Cells may respond differently. And again, this marker begins to reflect that. It is like an early warning system, but only if you understand what you are looking at. Otherwise, it looks like just another number. One of the biggest misconceptions in medicine is the idea of normal range. People believe that if their result is inside that range, everything is fine. But this is not always true. The normal range is based on population data. It includes a wide variety of people, healthy individuals, but also people with early stage conditions, people with poor lifestyle habits, people with hidden problems. So being inside the range does not guarantee optimal health. It only means you are not outside the statistical limits. But optimal function often exists in a much narrower zone. And this is where many people miss important signals. For example, a value may move from the lower part of the range to the upper part. Still normal, but something has changed. The direction matters. The trend matters. A single number does not tell the full story, but changes over time do. Another issue is interpretation. Most people look at results once. They do not compare. They do not track patterns. And because of this, they miss gradual shifts. But the body rarely changes suddenly. It changes step by step. And this marker reflects that process. If you only react when something is outside the range, you may already be late. One of the most commonly ignored markers in blood tests is hemoglobin. Most people only react when it drops significantly, when it becomes low, when a doctor says something is wrong. But the problem starts much earlier. Hemoglobin is responsible for carrying oxygen in the blood. It delivers oxygen from the lungs to every cell in your body. Energy depends on it. Brain function depends on it. Heart function depends on it. When hemoglobin begins to decrease, even slightly, the body feels it. But not in an obvious way. The symptoms are subtle: fatigue, low energy, reduced endurance. A person may feel that simple tasks require more effort. They may think they are just tired or getting older. But the real issue may be oxygen delivery. The body is not receiving what it needs. Another important detail is that hemoglobin can still be normal while trending downward. And that trend matters because the body adapts. The heart may begin to beat faster. Breathing may become slightly heavier. Over time, this creates additional stress. But because everything still looks normal, the problem is ignored. Understanding hemoglobin as a functional marker, not just a number, is critical. If hemoglobin is the visible part of the system, ferritin is the hidden reserve. Ferritin reflects iron storage in the body, and this is where things become interesting. Many people have normal hemoglobin but low ferritin. This means the body is still functioning, but only because it is using its reserves, and reserves do not last forever. Ferritin drops before hemoglobin changes. This is an early stage, a warning phase, but most people never check ferritin, or they ignore it, because again, it may still be within range. But low normal ferritin often comes with symptoms: fatigue that does not go away, low motivation, difficulty concentrating, a feeling of constant low energy. Some people experience hair thinning. Others notice that they feel weaker during physical activity. Sleep may also be affected, because iron plays a role in oxygen delivery and energy production. When levels drop, the entire system slows down. The most important point is this: ferritin shows what is coming next, not what is happening now. And ignoring it means ignoring early warning signs. Another marker that is often ignored is CRP, C-reactive protein. This marker reflects inflammation in the body, not acute inflammation, not infection, but low-grade, chronic inflammation, the kind you do not feel, the kind that develops slowly. CRP may be slightly elevated, still close to normal, not alarming. But this is where the danger is, because chronic inflammation affects everything: blood vessels, heart, metabolism, brain. It creates conditions where disease can develop, but without symptoms. People do not feel inflammation, they feel the consequences later: fatigue, reduced performance, subtle discomfort, but not pain. Another important detail is that CRP can fluctuate. One test may be normal, another slightly higher. This makes it easy to ignore this. But patterns matter. If CRP remains elevated over time, it reflects ongoing stress in the body. This is not something to panic about, but it is something to understand, because inflammation is one of the key processes behind many chronic conditions, and CRP is one of the earliest indicators. One of the most misunderstood markers in blood tests is glucose. Most people think glucose is only important if it is very high. If it is within the normal range, they assume everything is fine, but this is a mistake. Glucose reflects how the body manages energy. Every cell depends on it. But the problem is not only high glucose, it is instability. Even if glucose is technically normal, it may fluctuate. It may rise after meals and drop quickly. This creates hidden stress in the body. Another important point is trends. If glucose slowly increases over time, even within the normal range, it may indicate that the body is becoming less efficient at regulating sugar. This is often the early stage of insulin resistance, but at this stage there are no clear symptoms. A person may feel slightly more tired after eating. They may experience energy crashes. They may feel hungry again quickly, but nothing feels serious, because the number still looks normal. Another key detail is timing. A single glucose measurement does not show the full picture. It only shows one moment, but the body works continuously. And patterns matter more than single values. The most dangerous phase is not when glucose is high. It is when it is becoming unstable, because this is when the system begins to lose balance. And most people miss this stage completely. Cholesterol is one of the most talked about markers, but also one of the most misunderstood. Most people focus only on total cholesterol. If it is high, they worry. If it is normal, they relax. But this approach is too simple. Cholesterol is not one number. It is a system. There are different types: LDL, HDL, and others. Each plays a different role. LDL is often called bad cholesterol, but it is not inherently bad. It becomes a problem when it accumulates in blood vessels. HDL helps remove excess cholesterol. The balance between these types is what matters. Another important factor is particle behavior. Not all cholesterol behaves the same way. Some forms are more likely to contribute to plaque formation, but standard tests do not always show this detail. Another critical point is inflammation. Cholesterol becomes dangerous when combined with inflammation. If blood vessels are healthy, cholesterol may not cause problems. But when inflammation is present, the risk increases. This is why looking at cholesterol alone is not enough. It must be understood in context. Many people have normal cholesterol but still develop problems because they are not looking at the full picture. Understanding cholesterol as a system, not a single number, changes everything. Most people don't have a health problem. They have a signal they didn't understand. Your blood test is not just a report, it is a conversation. Your body is speaking, but not in a loud way, not in a way that forces you to stop. It speaks quietly, through numbers, through small changes, through patterns. And the biggest mistake people make is waiting for something to become abnormal, waiting for symptoms, waiting for something serious enough to take action. But the body does not suddenly break. It shifts. Step by step, a marker moves slightly, then a little more, then something else changes. And all of this happens while everything still looks normal. That is the danger. Because normal does not mean safe. It means common. And common includes people who are already moving toward problems. The most important moment is not when something is high or low. It is when something begins to change, because that is when you still have control. That is when you can still act early. That is when prevention is still possible. Your body does not hide the truth. It shows it in small details, in trends, in numbers you usually ignore. And the real question is not, is everything normal? The real question is, what is already changing before it becomes a problem? Because sometimes the most important warning is not the number that is out of range, but the one you never paid attention to.